So it's journal number 3. We've started in our second rotation. So I'm with women's soccer right now, which is my own team. So I do a lot of treatment times. I do pre-practice treatment and post-practice treatment to get my hours done. But I'm going to talk about how much progress I've made on one of my personal goals for my clinical packet. So actually today we taped a an ankle with a small contusion on the medial side of the ankle, and we used stirrups. We used moleskin for the stirrups, and to stabilize a little bit because the athlete was having trouble making contact with the ball and even pushing off at that because of the tenderness right there and a little bit of black and blue forming. Um, but we got to tape that, and going from volleyball to soccer and realizing the difference between that. Volleyball, they want them tied up top, tied around the ankle, and well, sometimes they want them loose around the top and loose around the bottom of the foot, the volar part, and they want it really tight around their ankle because of the jumping and the landing. But for soccer, we've noticed that soccer players are pretty picky about how they want their ankle taped and how tight they want the tape. So the difference is that I've noticed is they want as least tape as possible. They don't really want it to be that restrictive, but they want it to work. So sometimes we would use, a little bit more tape than we would just by personal fault, and they would want it taken off and retaped again because of restriction of motion or it's too tight. They can't move around. So I've noticed that, and taping from really tight with volleyball to learning to tape loose and fluid and still keep flat angles is kind of tricky, but I've gotten over it. And then one of my other clinical goal is that we've worked on, is me just being more confident in the clinical setting, and because I've previously said that we really don't know that much as a first semester in this program, but now that we've started modalities and I'm on my second rotation of clinical, they're teaching us more things. So I know how to do like massage, like manual massage on calves. I've been taught how to scrape. I've been taught trigger point. I've been taught suction cup. So I'm definitely being led by the upperclassmen and that my preceptor at that point to be. They taught me, and then for them to watch me a day or 2 or 3 days after, and they say that I am doing it really well, and that they don't. I would always ask if this is correct or this is correct, and second guessing myself usually, but to get good compliments and to know that I'm doing things right, and that when the athlete gets off the table, you can see either a change in how they walk or how they carry themselves. And I mean, when you're done with any treatment of that kind. You usually wipe them down or clean them, and then you would feel for the area that you've been working on, and to be able to feel the laxity, I guess you would say, or the knot's no longer there, or their calves or IT band aren't rigid. Um, for them to say that they actually feel loose is great, because I know that I'm doing something right. So being confident with that is great because now I don't have any question. I don't second guess. I know what I'm doing, which is a big thing because I want to be comfortable, but I also want to make the athlete comfortable. So if I second guess myself and have to um, every minute or so go grab someone, ask if I'm doing this right, obviously they'll get that in their head that I don't know what I'm doing and it might not be fixed. So there's that. So I've gotten a lot done within the past week. I got one mastery and I've gotten 13, no, I'd say 14 attempts this week. I've gotten probably 30 attempts, well, more than 30, obviously, this past couple weeks. But that's all coming to now because of we're learning things and preceptors are teaching us, we're learning things in modalities. And so that's how this week has gone. We did a lot of fun things. We didn't have modalities lab this week, but last week we checked all of the to make sure everything was calibrated and checked, so we can actually use those machines. So still really excited about the semester, but I'll see you next week for number 4.